Chapter 4, Part 2 will cover the implications classical conditioning has when it comes to drug addiction, advertising, and specific aspects of healthcare. To get started, we want to look at what classical conditioning can teach us about the development and the treatment of drug addiction. We know as a society that it's very difficult to deal with or discuss drug addiction because there's a lot of misunderstanding about the actual fundamental nature of the behaviors involved in the development of addiction. People tend to still think that developing an addiction, specifically drug addictions or alcohol addictions, is the result of a character flaw. And numerous avenues of research have actually showed that that's not the case. Drug addiction is at its basis a brain disease. While addiction to the drug, or a drug, does involve the brain, there are some aspects of addiction and addiction treatment that we can better explain by looking at the principles of learning. First off, I want to introduce you, if you're not familiar, to the concept of tolerance. We know that after repeated drug use, addicts, the level of the drug an addict needs to produce the same high increases. That's what tolerance is. After using a drug or substance for a long period of time, your body becomes used to it and you need more of it to get the same high or the same effect. Another concept I want to introduce you to or remind you about is withdrawal. And this is when after you stop using a drug, your body enters into a period of strong cravings and extreme physical discomfort. Your body is used to it, you're taking it away, and your body responds with intense cravings and a lot of physiological pains and discomforts, things like shaking, you can run a temperature, sweating, and so on and so forth. Relapse is when a person who has remained off of a drug for an extended period of time goes back on the drug. And we know that if a person remains off a drug for an extended period of time, the symptoms of tolerance and withdrawal go away. However, oftentimes relapse can happen because those symptoms pop back up. We talked about how sometimes during extinction or after extinction, we can spontaneously recover a behavior. This is similar to what happens with relapse. And oftentimes it's aspects of the environment or stimuli in our environment that prompt the reemergence of those withdrawal symptoms or craving that can cause someone to relapse. And these phenomenon can be explained by looking at classical conditioning. For example, when using a drug, you can think about the classical conditioning elements explaining various aspects of that process. The drug a person takes is the unconditioned stimuli. The high that it produces in them is the unconditioned response. The conditioned stimulus is anything in our environment that we associate with drugs or drug use. That can include things like drug paraphernalia, furniture, the people that you're around, the music you're listening to, the odor of the drug, the label on a pack of cigarettes. Anything that is commonly in the environment when this person uses drugs, or an experience that they have oftentimes at the same time as using the drug. For example, maybe the addict only uses when under extreme stress. That stress can become a conditioned stimuli and subsequently cause the conditioned response of the physiological changes that produce cravings for that drug. These associations are very strong and can make it much harder for an addict to stay off the substance that they're abusing. Interestingly enough, we know that research actually supports that the conditioned response suppresses the effect of the drug, which can partially explain tolerance. So, you're using a drug. At the same time, you're also having a conditioned response to the conditioned stimuli, which causes your body to kind of suppress the response to the drug. Think back to those theories of classical conditioning we talked about last time, and because of that, you need more of the substance. So this kind of framework for drug use also helps us explain tolerance. We know that if the drug doesn't follow the conditioned stimuli, you're in the environment that you're usually in or experiencing stimuli you normally experience when using that drug, but the drug doesn't enter your system, we still experience physiological changes that are experienced as drug cravings and withdrawal symptoms. So that same framework can also be used to explain, at least partially, these experiences as well. To remind you, some symptoms of withdrawal: anxiety, sweating, muscle aches, tremors, nausea, vomiting. Withdrawal can actually be extremely dangerous and occasionally life-threatening depending on the substance being abused. So, conditioning does seem to play a role in relapse because of that framework. The addict returns to the same environment, experiences the conditioned stimuli, the drug paraphernalia, the room, the people that they're with, the club where they often went when they used. It elicits the conditioned response. That can be cravings, that can be withdrawal symptoms, that can be tolerance that makes them need to take more of the drug. And together, these cues make abstaining from drug use very difficult. Aversion therapy, which we talked about in video 1, can also be used with drug addiction to help treatment. One study found that alcoholics who take a sip and because of alcohol and also consume an emetic drug, again, a drug that makes you nauseous at the same time, actually experience a decrease in their need for alcohol. So we can use the same aversion therapy principles that we do with treating paraphilias to treat drug addiction and alcohol addiction. Thinking back to extinction, we know that the cues associated with drug use are repeatedly present without the drug. We talked about that. Ideally, pushing a drug addict into experiencing extinction, where we're actually getting rid of this association between the environmental cues and the drug, should occur where the drug is taken. So by that, I mean when we are engaging in aversion therapy to bring about extinction, it actually helps the drug addict to do this in their own home. Or say you have someone who's trying to quit smoking who routinely goes to their garage to smoke. Their spouse doesn't let them smoke in the house. They go and smoke in the garage every night before bed. They go to a therapist, ask for help. The therapist begins to try to use these classical conditioning principles to help them break their addiction. It actually works better if that therapy was done in the garage where the person always went to smoke. That kind of takes that association breakdown even farther and removes as many of the environmental stimuli as possible. However, it can be risky, especially with more harmful, more dangerous drugs. So for that reason, it's often done in a clinic or in a therapist's office. This is another area where we're looking to use virtual reality to treat drug addiction. Because it can be harmful or dangerous for the body, it might be useful to have a patient have a virtual reality representation of that environment they normally use while they're in a more secure health location. A couple of other applications of classical conditioning I want to look at. The first one is advertising, and this is kind of the classic example people tend to think of when talking about classical conditioning. Advertisers often use these principles to try to help us or to make us form positive associations with their products. However, we know that a brief period of conditioning, maybe seeing one ad about Coca-Cola and Santa's in it, and it makes you think that Coca-Cola is happy like Christmas, etc., etc. Experiencing that for a brief period of time doesn't necessarily make people change their mind about brands, especially brands they already have strong opinions about. However, it can have a small effect on the choices that we make. So for this reason, advertisers continue to use these principles where they'll present something that makes us happy with their product. That's the neutral stimulus, the product, and whatever the thing that makes us happy, like Santa and my Coke experiment, that would be the unconditioned stimuli in their ads. We know that when the name of the brand is presented before the unconditioned stimuli, so Coke comes on the screen before you see Santa, that actually works better. Remember, we talked about that when we talked about the different types of conditioning. The same is true for advertising. Here's just a short example from a long time ago. People have been using these principles well before they were officially documented by scientists. In the 1800s, there was a floor cleaner that was turned into a medicine. Somehow they found out that it had medicinal properties, and they named it Listerine, similar to mouthwash today. And what this company actually did was they used the name of a well-known physician, Joseph Lister. He was highly regarded in his field and a lot of people knew about him, so they put his name on their new medicine, and it sold like hotcakes. Classical conditioning principles applied in real life. The last interesting thing I want to talk about is the impact classical conditioning can actually have on our immune system. Our immune system, our body's immunity, is actually susceptible to the influences of classical conditioning. For example, we know that allergic reactions are not 100% physiological, meaning that they're not 100% happening because an allergen has entered into our bodies. We can actually become allergic to things associated with an allergy or an allergen. For example, it's been documented that a person who was allergic to roses once entered into anaphylactic shock or some kind of allergic reaction when they saw paper roses. That association is so strong that the brain prompted an allergic response in the body. And a fun fact, chemotherapy, which is used to cure cancer, actively works by suppressing our immune system, and over time, cancer patients who experience the same stimuli every time they take their chemo or are administered their chemotherapy, they can actually experience a immune response to stimuli associated with chemotherapy. Maybe the blanket that they always take with them, or the people that they always go to treatment with. That brings us to the end of Chapter 4. Please email or call if you have any questions.